basic types of skin cancer. We'll start with basal cell carcinoma.
Yep.
So basal cell carcinoma is by far the most common type of skin cancer. The good news is that these are very slow growing. They are not typically aggressive. So, it's not uncommon for us to get a new patient in the practice and they say, well, this spot's been there for 3 years and it's just kind of slowly getting bigger, or now it's started to bleed, or now it's painful. And the great thing about those is that they're localized, right? It's extremely rare for a basal cell to go to a lymph node. I have had one patient that's happened to. Extremely rare though, and it's not something that we worry with patients. The next type I would say is squamous cell carcinoma, and that one is a little bit more aggressive. With squamous cells, I kind of like to think of them in two broad categories. We have our basic squamous cells that, can pop up fairly quickly. They can be painful, but they're kind of just like the basal cells. They don't spread. They're just on the skin. We're not too worried about them.
Okay.
Head and neck squamous cell carcinoma can be a little bit different beast. And those are ones that they can, if not treated quickly, go to lymph nodes. They can be more than locally invasive. They can get into nodes, and then can be pretty extensive treatment with those. You've got head and neck oncology involved, head and neck surgery, sometimes chemotherapy, immunotherapy, radiation. And I would say nowadays, immunotherapy and radiation would be the mainstay kind of adjuvant treatment that we'll see sometimes with those. But those are rare. I kind of give you that information to kind of understand that sometimes a squamous cell can be more aggressive than a melanoma.
Okay.
Which is not something that, we're really taught much in basic med school derm.
Sure, yeah.
And certainly not in the population.